Good morning and welcome to the first ever DOC Mental Health and Wellness Lunch and Learn. I'm Dr. Denise Malone and I'm very fortunate that I'm the Chief of Mental Health and Wellness. I'm a licensed clinical psychologist and a board certified behavior analyst, and I have been with the Department of Corrections for 12 years. So it is going to be my pleasure to do a general presentation for you. And then I'm going to turn it over to my panelists who will also introduce themselves and do presentations for you. And then Ms. Maria Stronsky, who is actually the Sex Offender Program Director, could not be here today because of a family issue. And that's why we have the benefits guru. Hi. Because state benefits are a wonderful thing, and Ms. Stronsky is able to be home today taking care of her daughter, and we as her team members are going to pick that up and tell you a little bit about the sex offender treatment services. So I'm going to start just telling you a little bit generally about Department of Corrections and Mental Health and Wellness's role. And I do have notes, but I'll probably just go off script. And your questions, I think we'll wait till the end and take the questions if that's okay. All right. So we are required by the Constitution to provide medical and mental health care in the prisons. And our care in the prisons is commensurate with the community standard for mental health care. And I would venture to say at this point, we are at or above those standards. And I'm very proud of the quality and quantity of services. We actually have full-time mental health staff at each of the major facilities, so all of the prisons. We also have district mental health clinicians in each of the probation and parole offices. Well, they cover the probation and parole offices. So, and also the corrections alternative programs. So we are covering the state with mental health and wellness services. We're excited about that. Our mission, I'm going to read it, is to enhance the public and institutional safety by providing quality assessment and treatment services to inmates, as well as consultation and training to correctional staff in accordance with professional and ethical standards of practice. So we're good clinicians, and we're also good stewards of the Commonwealth's money, making sure, as I said, that our inmates and other justice-involved individuals, the probationers and parolees, get a good quality and quantity of mental health services so that they can make the most of their second chances. I'm going to go off my presentation a little bit and brag. We are, once again, the second lowest recidivism rate in the country, and we've been either number one or number two for years now. And what that means is that folks who are in our facilities are getting out and staying out. They're making the most of those second chances. And I know that because the inmates, the former inmates, tell us that getting folks to a mental health baseline is important in them being able to be successful. So I'm really proud of that. We're very happy to have you here today, so welcome. We want to get to know you better. I'm sure that you already realize as astute clinicians that thanks to deinstitutionalization, jails and prisons have become the de facto mental health facilities. And that's true in the Commonwealth of Virginia as well. There are 26,000 inmates in our prisons, and we also have 66,000 on probation and parole. So as you can see, we're busy people. All right, we have about 200 staff statewide. As I mentioned, we do have mental health and wellness clinicians in all of the major facilities. Also in the field units, supporting some of the work camps. All of our mental health and wellness clinicians have master's degrees or higher. Licensure is preferred but not required. And we are able to supervise people towards licensure, and we're also able to supervise people to get their CSOTP certifications. So happy to be able to honor those commitments. We have about 14 to 16 licensed doctoral level clinicians, and usually those folks are managers. So Dr. Fink, who you'll meet here shortly, is also another licensed doctoral level clinician. We do have one board certified behavior analyst so far. Would love to hire some more of them because you're looking at her. So I'd be happy to talk to you about board certified behavior analysis as well. So what do? We are required by American Correctional Association and also just by our desire to do the best practices to provide core services. And those core services include screening, monitoring, crisis management, group sessions. We do some brief solution-focused individual treatment, but as you guys know, group treatment is far more efficacious and far more cost-effective. And when our inmates leave us, as 90% of them will, when they go out into the community, they will most likely end up in a group setting to get their services. So we're congruent with that model, providing group sessions in the prison. We do offer assessments, and we do a whole lot of training and advocacy with other disciplines and other agencies about the relevancy and management of mental health issues. I'm extremely proud we are a forward-thinking organization. We became mental health and wellness services in February of 21. And that was because we are committed to busting the stigma that mental health has had in the Commonwealth for so very long. And because we also realize as an after effect of the pandemic that as research has indicated, and we can tell you, we've seen it borne out, more episodes of depression, anxiety, more trauma symptoms as after effects of the pandemic. You're shaking your heads, you're seeing it too in your current places. So what we are doing is we are expanding services so that we can handle the wellness side and help people tweak their baseline so that they can make the best of those second chances. So we aren't waiting until someone gets to a crisis point when they come and see us. We're expanding our services and changing really our paradigm and our practices to embrace the wellness module. And trauma-informed care, of course. We will continue to advocate, educate, and market. And when I say market, that's letting people know what benefit mental health services are. We implement novel strategies when we need it. For example, during the pandemic, we created a warm line where inmates could call and get hooked up with mental health services, get hooked up with the providers at the facility. We also provided a wellness channel. So we had positive programming that was being available to the inmates while they were really watching the TV screens avidly like the rest of us were. We offer resource packets. We began using telebehavioral health. So some of those novel practices are going to stay with us now that the pandemic has seemingly abated. So what we're looking for is we're looking for people who are committed to providing high quality practices. We do have annual mental health conferences. You can get your CEUs with us. We have licensed doctoral level folks providing supervision. So I think as a clinician, we're a good place to grow and develop your professional skills. I will tell you, and some of you I spoke with before our meeting started, we do have a variety of clinical issues, and I will tell you that there is an increase in the acuity and an increase in the variety of clinical situations and clinical syndromes that we're seeing. So it's never a dull place to work. And we are very proud of the services that we already provide, and we're hoping that by you being here, that you're interested in being a part of our team. And we really are a team, and I'm so very fortunate to be a leader of this team. So please, if you're interested in either working at one of our facilities, in our correctional settings, it can all start today. So please, fill out an application, and let's try and get you on board. Now I'm going to turn it over to Dr. Fink, who actually is the Eastern Region Mental Health Clinical Supervisor. So thank you for being here with us today in the Eastern Region, and Dr. Fink can speak more about the Eastern Region.
I'm Julie Fink. I'm the Mental Health Clinical Supervisor for the Eastern Region. I'm a licensed clinical psychologist and also a certified sex offender treatment provider. I help oversee all of the services in our institutional facilities in the Eastern Region. We also have people who work in the probation districts. We're more of, I don't oversee them directly as our inmates are leaving us and going to probation. We are in consultation with them, but my oversight is predominantly with the institutions. So in the East, we have everything from work centers to maximum security and all in between. The East is pretty unique in that we also have a geriatric population in one of our facilities. We have assisted living facilities. So we are ranging everything from young inmates. We have a youthful offender program in the East as well. So from our youngest inmates to some of our oldest inmates. We have at Greensville Correctional Center is one of the largest institutions in the eastern part of the entire country. And at that facility, we have several licensed mental health units that are licensed by the Department of Behavioral Health. So they come in and check with us as well as our American Correctional Association. So we're meeting both standards with these populations. And that allows us to have this continuum of care to help manage our inmate population. Like Dr. Malone, I've been with the department now for 12 years. And in the time since I've started, the number of inmates with mental health concerns has drastically increased. So there is definitely a need for us inside the facilities. I can say one of the things that's very positive is because we have access to them through their sentence, you can see change. It's one of those ones where you can see the differences that you're making in an individual's life. They come in and initially they have feelings of hopelessness and concern. They don't understand their mental illness. They don't understand their medications. And through treatment, you can see the positive change. And in fact, some of them will call us afterwards. Once they're in the community, they'll call us back to say, thank you. Like, I have a job now, I'm doing well, I get to see my children, my family is happy. And so it is very rewarding. It can be challenging at times. It is, within a correctional setting. And so sometimes there are other behaviors. But for the most part, the inmate population is incredibly receptive of mental health, and they are very happy that we're there to serve them. And I would absolutely love to have anyone ask any questions, and please come talk with me. I do have several openings throughout the East in different populations, even some in my licensed mental health units. So everything from a general population to a licensed mental health unit is available. And like Dr. Malone mentioned earlier, I do have supervisors and staff who are eligible if you're working towards a certification or a license to help provide those hours of contact with you.
Before I turn it over to the benefits guru, I'm going to talk about, I know everybody wants to know that part, which is wise, you should. Thank you, Dr. Fink. So as Dr. Fink mentioned, currently when she and I started at DOC, about 14 to 15% of the inmates have mental health issues. Currently, it's 35%. Mm-hmm. Now, I want to talk about the other 10%. So approximately 10% of our incarcerated population are folks with sex offender history. So this is a subspecialty in mental health and wellness services. And currently I'm talking on behalf of Maria Stronsky, the sex offender program director, who could not be here with us today. She needed to be with her family. So just to say, as we've mentioned, there's the licensed mental health unit. The sex offender residential treatment unit is located within our Greensville prison. Now, we do provide sex offender treatment services in other prisons besides Greensville. That's more of the SOAP groups are at other facilities. And I don't have those listed, unfortunately, but Ms. Stronsky could tell you.
In the East, it's almost every facility except for Lawrenceville and Sussex 1.
Okay, great.
And Indian Creek. All of our other facilities run sex offender services.
Okay. And the sex offender services work in conjunction with other departments to provide the sex offender treatment. We provide psychoeducation, therapeutic, and residential. In the facilities in each region, we cover security level, all the security levels that Dr. Fink just mentioned, and we do work with males and females. There are many misnomers about sex offending. So sex offender treatment probably isn't what you might think, but Ms. Stransky would be happy to talk to you about that. And we do offer, as we've been saying, on-the-job training, including the assistance getting the CSOTP or keeping the C-stop. So that's what I have for you about sex offender treatment services today. Turning it over to Mr. Benefit.
Thank you guys so much. It's a pleasure being here. So when you have decided that you wanted to come to work for the state, there are a lot of opportunities in regards to making sure that you're covering yourself, your family members, and your mental health, which is one of the reasons why we're here. The first thing that I would like to bring up is that the benefits team, we coordinate with the employee health and wellness team. So we provide solutions in regards to making sure that you're taking care of your work, that you have the resources available in the event that you need to speak to someone, as well as making sure that you are able to work in a comfortable environment. Some of the benefits that we offer for new hires or new state employees would include retirement. So if you are becoming a full-time employee, you can expect to be contributing to what's called a Virginia retirement system, a retirement program. This is going to allow you to accumulate service time so that once you are ready to retire, you're able to enjoy making sure that you're still getting paid for the services that you have committed to this Commonwealth of Virginia. There are also other retirement programs that are available to supplement your retirement plan as well. So we're really big on making sure that not only are we taking care of you while you are an employee, but also once you transition into being a retiree. We have a robust health insurance program. So we don't just have one health insurance, agency that we work with. We work with Anthem, Aetna, depending on what region you're on, Kaiser Permanente, as well as Optima. And this allows the employee to really be able to select what health insurance plan works best for them. And not only do we have these amazing health insurance options, but we also have key resources that are built to aid in assisting our employees in finding the correct health insurance plan that works best for them. We also have an open door policy, and a lot of people don't understand that that's a benefit in itself. And with our open door policy, we strive to develop and maintain communication with our employees just to ensure that we are doing what we need to do to develop you, to move you up to the next level. We also have ways to where if you have former state employment, or if you have former federal employment, there are ways that you will be able to tack on that service onto your state service and utilize benefits as well, such as increasing your leave accruals if you were in the Army or the military, as well as increasing your retirement benefits and enhancing them. So there are a wealth of opportunities in regards to making sure that you're taking care of your mental health while you are taking care of others' mental health. And that's what our benefits program is designed to do. My name is Brandon Stanford. I do work at headquarters. Pretty easy to contact just by reaching out to me via email, or you can reach out to me in person or via phone. But I would love to answer some specific questions about any of the benefits and programs that we do have to offer. And as they were stating, not only are you able to get on the job training, but we do also have a great tuition assistance program. We also participate in the federal loan forgiveness program for public employees. So working for the state is an agency that would allow you to continue to make payments on your student loans for up to 120 months. After 120 months of continuous payments, then you would be able to be debt-free and from your student loans. And you'll be able to go back to school and not have to worry about paying for it. So I think that this is a very unique opportunity to not only really make an impact on the public, but at the same token, make an impact on your own lives as well by utilizing some of the state benefits that we have in place to make sure that we are taking care of you, the people that are taking care of the state.
Thank you, Brandon.
You're very welcome.
It's your turn. Do you have questions for us?
I have one question.
Certainly.
It was about benefits.
Yes,
For the loan forgiveness, how long would you have to be employed in order to take part in that?
That's a very good question. So are you talking about the federal loan forgiveness program?
Yeah, so the
Okay.
120 months of the continued payments, is there like a specific time you have to be employed?
There actually isn't. So that is just based on the way that it works is during your time of employment, if you've worked for 10 years and during that 10-year tenure, you have also made 10 years worth of payments or 120 payments towards at least the principal amount of your loan, then at that point, that's when you would fill out some paperwork, you would meet with your human resource representative. We do have my partner, her name is Lucretia Davis. She actually works with the federal loan forgiveness program, and you would be able to partner with her to get that taken care of, and she would go ahead and direct you to the appropriate channels. Now, that's not to be confused with tuition reimbursement. That is something that you're eligible for once you walk in the door. So if you are still in school, and let's say that you're doing great in school, you're making at least a C average, and you're doing what you're in school for is parallel to anything that DOC has to offer, then we would also assist with student loans as well, up to $5,000. You're very welcome.
And I can say the federal student loan forgiveness works because I got mine paid off last year.
I'm working on mine. So,
happy.
So these benefits really do work. So I think that, we have the benefits program with the way that we do to attract employees that really care about public safety. So we want to do everything that we can to make sure that, we're doing the best for the people that are working with the state.
And I want to throw out there that during the pandemic, what I heard from colleagues who didn't work at DOC, so other people in the mental health field that didn't work here, is how good actually our benefits are. Mm-hmm. So we have sick leave, we have annual leave. You can take your mental health day, you just let your supervisor know. So we also had the FMLA.
Correct, Family Medical Leave Act. Which and you want to know something, after working for a year, whether you're part-time or full-time, or if you've worked just 1,250 hours, in the event that you are a direct family member, or if you have a child or adopt a child, any of those instances would allow you to be able to take some time off to really bond with your family and get things taken care of. We also offer, there are 12 holidays with 13 paid days off throughout the course of the year that does not come out of your annual leave. We offer sick leave, which is a separate bucket from your annual leave. In certain instances, you may be eligible to receive recognition leave, compensatory time. And let's say that you have accumulated, let's say 300 hours over a 20-year span of working with the state. Well, we would be able to pay you back at least some of your hours that you have not used for leave. 20 to 25 years, you're able to get a payment of 336 of your annual leave hours in the event that you have not taken them. So a lot of us work hard. A lot of us, are really dedicated to what we do. And there are times where we're not able to take that vacation that, we would want to take on an annual basis. Well, we would still make sure that you're taken care of as well. So there are a lot of things that we have in place to make sure that we really are showing the value of, our state employees. So,
and I'd like to mention as well that we do work in a multidisciplinary way. I'm very, very honored to be a part of a team. And we also are working now in a multi-agency way. So the continuum of care that Dr. Fink references, we are working now with other agencies as well. So I'm really proud of the very comprehensive role that we play in getting folks who have mental health issues, who have also been justice involved, back into our communities and our neighborhoods. So very, very pleased about that. And one of the questions you're being polite in not asking but that we do get asked is if we feel safe where we work. You never forget where you work, so you want to be always, of course, you want to be mindful that you are in a correctional setting, and it of course has some challenges, and that's one of the things where being a part of a team and having a good, strong supervisor plays in. But the other piece is, I will tell you, I feel safer in any of our facilities than I would feel going to a big box store on a Saturday night.
This is true.
Yeah.
I've had the honor of touring some of our facilities as well. And I can definitely say that there are things that we do here in the Commonwealth of Virginia that really set us apart from other states. We're one of those states that other states and even other countries look to kind of model our correctional structure. One thing that I think I like the most about our agency is that we're not state prisons. We are state correctional facilities, meaning that you have done something that you need to take a moment to think about and correct. And then we would like to, give you a second chance. So we're really, really big on being a healing environment. And that's another reason why we're seeking quality people that really care about mental health as well, because we want to strive to continue to pursue being the best in the nation, one of the best in the nation, and making sure that we are advocating for public safety as well as, correcting behaviors so that when people do go back into society, that they're not making those same mistakes in return.
Yeah, and I started my career working inside St. Bride's Correctional Center, which is in Chesapeake. It's a low-medium security facility, so I started there. And now with covering the region, I spend my time, driving between the facilities, and I am in the facilities all the time, walking amongst the inmate population. And like Dr. Malone said, you remember where you're at, and so you're just mindful of the things around you. But I don't ever really feel unsafe. I've never had anybody that scared me to the point of not wanting to ever return to work again. And I like that as I've been working with the state, that mental health opinion is asked for much more frequently. It's not, we're, going to control these inmates and we're going to do this. It's how can we do it so that way we can teach them, we can help them, because they realize that, if people's mental health is handled and they're feeling well, that the inmate population is going to interact better. It's going to be safer for staff. It's going to be safer for the other inmates. And so we are really valued, and our what we have to say is taken pretty seriously.
Trauma-informed care is alive and well in Virginia Department of Corrections, and we both actually work as instructors for the crisis intervention team. So you can Google CIT. It is a wonderful, wonderful program, and it is being used in catchment areas by law enforcement all across the Commonwealth, and we have our own version of it here in Department of Corrections. So that's something else that we should say. If you have a special area of interest, and it might be transgender, it might be geriatrics, it might be trauma-informed care, it could be a variety of things. We're doing more and more work with the folks on the substance abuse side of the house to address substance use disorder. So if you have a specialty or a special area of interest, we're probably a really good place for you to work, because we welcome subject matter experts. And some folks, Dr. Fink is one of them. Dr. Fink was actually very interested in trauma, wrote a curriculum, which is now used at our academy and trained for folks. So if you have things that you are interested about or specialties that you've honed on the outside, we probably have a place for them within our continuum of care, because we are always striving to make our services better and more applicable to folks getting their second chances. Anything else?
Yeah. What does it take to get the sex offender certification?
So you do need to have, well, you actually have it. So do you want to speak to that?
So there's a training requirement. So there's coursework in like treatment, theory. There's like 4 or 5 areas where you get training involved. And then you have supervision with someone who is a CSOTP as well as a licensed provider, so an LPC, LCSW, a clinical psychologist. And it's about a year's worth of supervision. Once you have that training and that year's worth of supervision, then you just you submit the paperwork to the board.
And then you take a test.
No test. No test. But then you do have continuing education. And one thing that's nice with working with the Department of Corrections is because we have SOAP classes and we have the need to provide training for the need to provide service for sex offenders. Every year, the Virginia Sex Offender Treatment Association has a yearly training where you can get your CEUs towards the CSOTP, and that's the Virginia Department of Corrections covers it for those of us that are certified and those that are providing the services.
So the coursework is within the corrections or the...
You can get, to become certified, we have all of the training within the department. So it could either be training that's done online, we have classes up at our academy, and with VADOC, you can get all of the training that you need for the certification.
I have another question.
Sure.
So, coming out of community-based work, there's a lot of paperwork. What is your paperwork look like?
It is way better. One thing that I can say is that we, at the moment, do not have an electronic health record, and so I think it's coming.
We're closer than we've ever been.
But from the community, the paperwork is a lot less.
Okay. So everything will be like handwritten or typed and submitted since you don't have an EHR? And then would it be similar to with being in the mental health clinician role? Would it be similar of having like a safety plan, a treatment plan, and then just regular notes, or is it
Less. So it depends. If you're in just a facility or if you're in one of our licensed mental health units. So our licensed mental health units follows the criteria of DBHDS. And so those do have treatment plans, they have psychosocials. In general population, there is a small treatment plan for our inmates that are seriously mentally ill. You'll have progress notes or a group note. You'll have your initial intake screening and like a discharge summary. But it's a lot less.
Okay, and then my last question, because you were talking about like safety. So is everyone trained in like some type of handle with care, or is that not a necessity because of the different roles?
So there's definitely different roles. At the facilities, they do have, it's for the correctional officers, there is, I'm trying to think what they call it.
I don't remember.
We have in-service training, is that what you're thinking of?
Well, it's not the insert. So with the correctional officers, they have specific training on how to handle situations. Mm-hmm. When there's a crisis, if there's a fight, we are not expected to do anything other than if you see it, report it on a radio. Yeah, we don't have to respond. That's not our role.
Now, we do a lot to help de-escalate. So we might be members working with the correctional officers and CIT. So mental health staff, of course, we're relying on prevention and verbal de-escalation skills and strategies. So we might help train other people in those. Because some of the things that are just part and parcel of what we do for a living are so valuable to the other disciplines to know and understand.
These are some really good questions.
They are. I'm loving the
Very,
questions.
very good questions.
Because we also are a learning organization, so our programming at each facility, the staff kind of get to determine the needs that our inmates have. And so the programming for mental health is evidence informed. And so if there's trainings or programming that you feel the inmate population needs at that facility, we can always adapt, change, and add programming. We have a form that we kind of fill out and we send it to our steering committee who kind of oversees it to make sure that everything looks appropriate. And so our programming with our inmate population is changing. We've got everything from trauma groups, and then we even have things where some of our higher security levels got to grow vegetables in a garden. And then at the end of the group, when the vegetables were grown, they were able to have kitchen staff cut them up, and they were able to eat the food that they were able to grow throughout the year. So we try to be very innovative in our programming. I know sitting down in a workbook isn't for everybody, so trying to find ways to get them to engage and to want to come to our programs is something that we're doing.
Do you all do travel pay reimbursement for people who travel from a specific area? Like if you live 45 minutes or more away and you are traveling, do you need reimbursement, or is it encompassed in your pay when you go over your salary?
I can answer that. So it's kind of a mix. So your regular work commute, so from your home to your facility, we don't cover that. But if you were to go to a different facility or do any type of travel outside of your normal commute, we do have state vehicles available, but you can also be reimbursed. It just depends on the availability of the state vehicle. Additionally, if you have to do overnight travel for any reason, it does have to be pre-approved, but you would get reimbursed for that. And it's very rarely that it gets denied. If that helps too.
Okay, thank you.
And we do try to work as a team. This past year, coming out of COVID, there were periods where we brought in a significant number of inmates from the jail into our facilities. And so at that time, staff from our other facilities, traveled to there to help with that intake process. And so, at that time we helped, if they needed to stay overnight or making sure they had a state car or got reimbursed. So we really do try to work as one within the agency, even though we are kind of our own separate facilities.
Is there an on-call process, or is it once you're off the clock, at 5 o'clock, then you're off the clock?
So we do have on-call at the facility. Well, we do have on-call. Basically, it rotates between the staff. Some facilities prefer to be on-call for a month. Some of our facilities are only on-call for about a 2-week period. And so if you're on-call, it depends on the facility. Some of our facilities have a little bit higher rate of telephone calls, and some of it is due to having our licensed mental health units there or just a larger population of inmates. But generally speaking, on call is, passing on some information on how to handle a situation. Depending on what the situation is, occasionally we do have to come in if we've had a serious self-injury or a suicide attempt or something like that. We may have to come in and see the inmate. But if you do have to come in, we do work with you to kind of flex your time off, because we know your own personal time is very important and we don't want you to get burnt out. And we are huge proponents of self-care.
And the flip side of that is your supervisors. So for example, Dr. Fink and I, we're on call 24/7. So you're not there by yourself. You would have access to a licensed clinical supervisor to bounce ideas off of. And in fact, that actually happened to Dr. Fink this weekend. So somebody needed a consultation and she took care of that. So we take your professional well-being very seriously as well.
Thank you.
So I'm assuming that your facility has sex offenders, so they're spread among all the facilities.
Yes.
They're spread among all the facilities. Now, the sex offender residential treatment, of course, that's a different program, and that actually is located at Greensville, and there's 86 beds there.
And for inmates to go to that facility, they have to be within the last 3 years of their sentence. So they get that more intensive treatment just prior to their release.
but the wide majority of folks with sex offending history will end up having the group, the SOAP group, and that can be at a variety of other facilities. So most folks with a sex offending history, it's not of the degree or the severity of which it would necessitate a Greensville assignment.
Yeah, a lot of our inmate population, when we look at their risk for recidivism, because they're on the lower end, they just need the psychoeducational group. What we know from research is that if you give a sex offender more programming than what is needed based on their current risks, we could actually increase their recidivism. So we want to give them what they need and not more.
That's interesting. I thought more is better.
No.
More is not always better.
And as Dr. Fink said, so we are evidence-informed or evidence-based programming. And why we have to say evidence-informed is some of the things, for example, the one group she mentioned, and it kind of caught your attention, I could tell, is we have a symptoms management through horticulture or symptoms management through music. And what that does is that attracts inmates who normally would try not to end up being referred to mental health or not to volunteer to come to mental health, although other people might think they need their services. But some of these other groups are actually, think of it as mental health light, and it gets the inmates over to the mental health unit without them being assigned the label or the diagnostics. And it also gets them accustomed to working with mental health and seeing us as a benefit and seeing us as valuable. And that's such a great thing when they leave us, as 90-some% will, that they are more open to working with mental health professionals because they've had a more positive experience. So yeah, some of our groups are evidence informed because we are cutting edge, and the way that you get the evidence to be evidence-based is you write up this pilot program, you present the group in accord with how you have it written up, and we make data-oriented decisions in mental health and wellness services. So we are looking at the groups and saying, wow, this group was efficacious. We're going to offer it again. We're going to offer it at other settings. So symptoms management through horticulture actually started out at one of our maximum security prisons in the Western region, and the person who started that actually came to the Eastern region to help them set up their program because we saw from the data that it was so effective. So that's very exciting. We're breaking ground, like literally. These are great questions. More questions?
Substance abuse is also spread well.
We do have some specialized units and programs, but you can get some sort of substance use programming depending on, again, the level of severity. Not everybody needs like a residential program. Mm-hmm.
And you do have a residential program within.
We have an intensive program, we sure do. Mm-hmm. Yeah. Several of them actually now. Mm-hmm. Yes. We're doing some really interesting things. See, I told you guys I can't stop talking because we do such great stuff. So we're doing some really interesting things, like we're doing more and more peer supports and mentoring. So that's happening within DOC currently.
And we are, at a couple of our pilot facilities, we're partnering with DBHDS for the medication-assisted therapy, especially
Yes.
for our guys that are getting ready to go home to the community, making sure they have that treatment so that way their transition goes better.
Exciting times.
For your youthful offenders, are they in their own separate facility, or is it like a separate wing? How is that set up?
So we have two facilities who have the youthful offender program. So the majority of them are at Indian Creek, which is in Chesapeake, and then we have a smaller number that are at our Sussex complex at Site 2. So everyone within, although they are identified as a youthful offender, they're at least of the age of 18 years old. So they are mixed in with the other general population. Although at Sussex too, we kind of keep them a little bit more separate from the rest of the facility, but they do interact with the other population some.
So if there's nothing else, we're going to, again, thank you for coming, and we're going to be here. In fact, we're going to leave this front table and come sit out there, and we are going to all have a very nice lunch together. So thank you again, and we look forward to getting to know you guys better. And to those of you on camera, we hope to be meeting you soon. Thank you. Bye.